Hi everyone, it's Monique from Kids Chatter Speech Pathology. We've had a few inquiries this past week from parents who are concerned about the little ones stuttering. So I wanted to give you some information about what stuttering actually is, when it typically starts, and if and when you should do something about it. So stuttering most commonly starts between about the ages of 2 and 5. It typically tends to coincide around the time that children go through a big spurt in their language development. And a lot of the time, parents often describe it to me like as if their brain is going so fast because they've learned all these new words, but their mouth is sort of having trouble keeping up and getting the words out. So if you've ever sort of seen that your child seems like they know what they want to say, but they just sort of can't seem to get it out and they're stumbling over the words, that could potentially be the sign that they're stuttering. So usually it starts between the ages of 2 to 5, as I said, but it does typically start in those sort of earlier years. So, and there's actually 3 different types of stutters. So the first one is the repetition, and those are the ones that most people are probably familiar with. And when a child starts to stutter, it typically does start with that repetition. Now these repetitions can happen on just single sounds, they can happen on a syllable of a word or an entire word, or sometimes even a whole phrase. So you might hear your child say something like, I want that. Or they can say something like, I don't know what to do. So that's where they were repeating the full sort of phrase. But that repetition is usually the most common one that we see in stuttering, and it typically is where children's stuttering will start. Now, the second type of stuttering that we see is something that we call prolongation. And what that basically means is what children are doing is they're stretching out the sounds. So they're having trouble in actually saying the word because they're just sort of holding on to those sounds. And the third type of stuttering that we see, and this is usually the more severe sort of stuttering, is something that we call blocking. So this is where they actually get stuck on getting the word out altogether. And it usually will look something like they get stuck on the word like that. Often we tend to see as well, we see a lot of sort of tension in their face or their shoulders, or maybe their eyes might start blinking quite a bit. But that blocking is sort of the more severe type of stuttering. And especially if you hear your child doing that, those are the ones that we definitely highly recommend that you seek some help for. So in regards to actually getting some help for stuttering, when is the right time to seek some professional advice regarding stuttering? And depending on whether or not you've looked online for some information or have spoken to other people about it, there's a bit of a mixed information about this. So some places will say something like you wait 6 months to wait and see before you tend to seek treatment. Other places will say get treatment early, because there is this some children actually have what we call a developmental stutter. And what that means is that after a little while of stuttering, they can actually grow out of it. So although yes, it can happen that children may grow out of stuttering, and this is that developmental stutter where they're sort of just figuring out those words. So remember how I said that language boost that the kids go through. They sort of figure out the words that they've all got stored up in their brain and they manage to work it out. So it's sort of a temporary thing where they might stumble over their words, but they eventually figure it out. So these sort of kids are probably going to be okay. However, recent research has come out and is actually now suggesting that when you do hear your child stutter, to actually seek some professional advice as soon as possible. Because the problem is that although children may have this developmental stutter that they can grow out of, we actually don't know whether or not they will grow out of it, or whether or not they are going to need some additional help down the track. So this is one of those things that no one actually can predict ahead of time. Now, we as speech pathologists are highly trained in stuttering, so there are certain things that we actually listen to and look for when we see a child with stuttering to make sure that this isn't just sort of one of those developmental ones, or if it's sort of more severe. So things like those bodily movements and tensions that we tend to see that often coincide with the blocking, so that eye blinking or tension in the shoulders and things like that. If we see those things, even if they're just doing the repetitions, those are usually signs that there's something more severe going on. Same thing when they're stretching out those sounds. It tends to tell us that the stuttering is a little bit more severe than when they're just sort of stumbling over the words and repeating things. So, and with the research saying as well that now the recommendation is to get help as soon as possible. The reason for that is also that apart from not knowing which child has got the developmental stutter or the ones that actually go on to have a more severe stutter, the other thing too is that early intervention is absolutely the key when it comes to stuttering. We know that the longer a child continues to stutter for, the more difficult it becomes to actually treat it. So if you see that your child is actually stuttering and you wait 6 or 12 months or even more, that stuttering tends to become more of a habit. And the longer a habit continues, the harder it is to actually fix it. So when it comes to stuttering, our recommendation is as soon as you notice it, try and get some professional advice. Now that could be giving us a call and actually telling us what it is that you're seeing, so describe it to us, and we'll be able to give you some tips over the phone, or we'll be able to give you an indication of, well, is this something that's a little bit more severe and it's worth coming in to see us for, or is there some things that we can help you with over the phone? Ultimately, we can't actually make those decisions without obviously seeing your child in person, because it is more than just the words that they're coming out with, it's lots of other things as well. And that's why, although we can be really good with giving you advice, it's really hard to give you specific advice without actually seeing your child. But because stuttering is one of those things that can often get worse over time, and which makes it much harder to treat, it is definitely recommended to come in as soon as you can. The other thing too is that research is suggesting that if treatment for stuttering isn't started before about the age of 6, there's a really, really big chance that those children tend to go on to have a stutter for life. So that's another really, really important thing, that even if they are 3, so they, are obviously 3 years away from turning 6, it is still really, really important to get onto it early. And especially if your child is coming up to that age of 6, it's even more important to get onto it as soon as possible, because we don't want something like this to be there for life, when it is something we can usually very successfully treat when you come in early. So if you do have any more questions about stuttering, or you have concerns that your child is actually stuttering, please give us a call or contact us on Facebook, and we'll be happy to give you information, or come in and see us and we can give you the actual strategies on how we go about treating stuttering.